I think my talk's a little bit easier because we already had several talk about the limit of viability earlier. We had a colleague who talked about antenatal counseling. Then we had a talk about how to manage the labor ward. And then we had Dr. Nervi today actually give us an excellent talk about some of the data to look at it. What I will do today, really trying to make it a little bit easier because I'll emphasize some of the Dr. Nervi things said, but also use some local data because we said it's really important. I think the way, if I remember very well during my training, that in the really kind of late 1990 or mid to late 1990, we were worried when we had 30 weekers, because they didn't really do well, compared to what they do now. I call them really almost geriatric patients. They are really so good, survival well. Very rarely, we're going to have them have significant RDS or chronic lung disease or even IVH, unless there's other contributing factors. So now on the unit, really, that when I hear about a 22-weeker, before I used to say, why? Why did you admit this baby? Now I'll say, oh, how is the baby? And it's really true. There's a trend because we can see it. I mean, some of the data that, Dr. Narvi presented, I am presenting, these really from 2016, 2018. That's by looking at some of the outcome of these things. So I don't have anything to declare. And I'm just going to do briefly a few slides. I'm just going to mention a scenario. A typical, really, a mother who's been trying to conceive for 10 years and then she was conceived. IVF, she had two twins, presenting in labor out of hours, 22 plus 2, in this case, actually, bleeding and had a rupture of membrane and also complicated chorioamnionitis. So now will become really, what are we going to do? And so, yes, we talked about antenatally, how you talk about parents. Are you going to use the spike or ABDCE or other ways of doing counseling with parents? But I think we get stuck then we say, that's what happened in the state. That's what happened somewhere else. But what about here in UAE? What does that mean? And really, there's a big variation, even within the state. If you look even the UK, the variability between one outcome to the other, even for a level 3, will be different. So I think it's important to visit this. So this parents, as I said, she wanted everything, the mother, absolutely everything. We talked about antenatal steroid, even so a lot of it is actually has to do with observational studies, expert opinion, and instead of actually evidence, she still says she wants antenatal steroid. So we went ahead and when we did that, and we talked about what should we do when the baby's born. And despite that, she says she wants everything done. And so really, we are saying here that these babies have significant abnormalities later on, according to the data that we knew previously. And neurodevelopmental is another one, but the parents still want it. And I think we've all been to extreme prematurity. We discuss with the parents and tell them what the outcome was likely to be. But they still, when that baby is born, that mother will scream the place down and the father, please do everything, because that baby is born alive. So it's not easy. And you prepare yourself to actually, what are you going to do next? Even though you said, I'm not going to do anything, I'm just going to leave the baby. But I think the data suggests something else. So in our case, really, we had 2 babies, as I said. One is 504, and the other one, as I said, a boy as usual, second, and a smaller boy. And he's later probably, would have been really definitely trouble during the neonatal course. And they were actively resuscitated as the parents wish, and intubated and admitted to an ICU. And this is the word that I'm going to use, is active management. And I'm going to talk about active management. I know we showed around 30% survival. These are not all babies who are born at 22 weeks. These are the babies who are actively managed. And definition of actively managed is actually the baby being resuscitated, intubated, these babies who actually has surfactant, these babies actually who has ventilator support, they had a volume expansion, at birth I'm talking about, and blood pressure management, and later on. So there's more about these 2 groups, and I'm going to show some of the data for that. So this is just a picture of the 2 twins. Okay. So now going back again, infant mortality. really 70% or 75% of infant mortality is due to neonatal mortality. And if you look at neonatal mortality, there's three main elements of it. And one of the biggest one is prematurity, which is more than 40%. So that's significant. Even then, neonatal mortality is still the highest reason for children dying at 5 years of age. So we're having now the impression, we're having a lot of these babies on extreme prematurity being alive and getting discharged home. So I'm just going to show my idea is really trying to say, please forget about what you knew about premature babies 22 weeker, say 5, 6 years ago. It's different now. So, and that's what I'm trying to look. So I'm looking at several data. One is from UK data and the others are from US. So if you look at 22 week, I'm just going to consider 22 week, but you can look at 23. So, I'm making comparisons to say there's no difference really between the two. So if you look at it, majority in Epicure, 1995, there was the whole unit in England, actually, it was at that time. And they looked at, survival, of babies below 25 weeks. And so 1995 was very easy, but there was a lot of issue with that. There was a lot of babies who were born alive, but not declared alive because the baby, this baby has heart rate, yeah, leave it, it's not alive. So there was a lot of problem with that early stages. But you can see most of these babies who actually died early and then has severe disability, very, very few number. And then repeated that Epicure 2, 2006. And again, really, things has not changed in Epicure 2. The difference is that we were better to keeping some of these babies alive the first week of life. Yeah, but later on with BPD and everything else was really similar. So that's it. And if you look at 23, again, in Epicure 2, a little bit better than 22 weeker comparing to 2006. So that's all, just highlighting that part of it. Now, if you look again, estimated survival if actively resuscitated. Please remember what active resuscitate means actually. So if you look at all the first from the, the Embrace, you look at the British from 2016, the Swedish from the same year, and also you got a neonatal. I'll talk about that a little bit more in detail about the NICHD Neonatal Research Network and the systemic review. Overall, you're talking just for 22 weeker. Let's see if I can highlight. Yeah, 22 weeker. Again, we are highlighting really around 30 on an average survival. Okay. Now, if you look at of severe disability, so we talked about survival. What about severe disability? If you look again, overall, there's a big variation between the different from the Epicure 2 and the Swedish and also the network and also international data. So you can see, but again, there are none of them. If you take at least one of them out, the rest will be kind of similar disability, severe disability. Oh, difference, okay. I should finish. Again, I'm just going to highlight this again. We're looking at, if you look at where you are when you are 22 weeks, yeah, and I'm going to show it here. Again, you can play it both ways. If you're a Republican or Democrat, you can play the data the way you want. You can say how many babies actually born alive. You want to make a point for that, one out of 3, or you can say, 7 out of 10 die, yeah? And the same thing for the disability. Again, we talk about, 1 in 3, severe disability. Or the other way, say 2, 3, 2 disability. But remember, even the ones who don't have disability, a quarter of them will have moderate disability and learning difficulty. Again, if I go to the network from 2013, 2018, around almost 11,000 babies born from 22 to 28. There were, again, 19 US academic centers. So these not just any normal, there's academic center. And the survival overall to discharge was around 11. But if we're, if you are actively resuscitated, then it's 30%. Again, I just added later, actually earlier, I just put a little bit the 23 weeker to show the difference. So survival, that's an important. Survival for more than 12 hours, yeah, around a third of these babies survive the first 12 hours. So there's a lot of babies who will not survive in early stages. And then this is for overall babies, yeah? And if you're active resuscitated, you're almost 80%, you survive more than 12 hours, first 12 hours. And then if you go survival to discharge, 11%, if no active resuscitation as an overall, then it's 30% active resuscitated. Going home, similar thing. Everything shows you if you're active resuscitated, there is a higher incident of going, surviving and discharge. And I put, again, next to a 23-weeker, no difference, really no difference between them. Again, these are the things you are very interested, again, to say, okay, what happened to the IVH? If you look at it, at every aspect, really, you do not see a difference between the two. I was surprised about only 2% needed shunting, but again, not a lot of them actually survived. So if you can look everywhere from ventilation, around 8 to 9% of these babies at 36 weeks did not have BPD. And the rest, they had different BPD. Neck, surgery, survival, and also, the length of stay, the similar thing. Okay. Now, just a study from Abu Dhabi, which has looked at 67,000 deliveries for over 9.5 years, up to 2020. And that's really looks specifically for babies at 22 weeks. I'll show you the next slide, which is 134 ladies actually came in labor, 77, they were alive, live birth, pregnancy. 77 live birth. Out of that, 49 were offered stabilization because they showed sign of life, was easy to do things. 20 of them admitted to NICU. And out of 20, 4 of them only survived. And out of that, they have significant moderate to severe neurodisability. They all, they all had degrees of neurodisability. And I actually mentioned about seizure disorders, spasticity, discharge home, and some of them discharged to long-term care. And one of them had retinal detachment, which was really important. So again, so put that in mind, please. Now, our data actually, SSMC is only 3 years now since we opened. We had around the 2020 to 2021, we had four babies, and after that, 3 of them actually survived and did really well. Again, learning lesson, I think Dr. Nervis talked about it early. Please use your data. I think if anybody asked me, I will not say 30%. I will probably say, anywhere really between 1 to 2 babies will survive, which is really, really important when you counsel parents. Disability, the same. It is so wide range. Even so, we said 3 and 10, but it's also between 20 to 49. Yeah, so you cannot really, severeness are discussed about. I find there's no difference in data. Data really talks. There's no difference between 22 and 23. If you resuscitate it, please make sure the baby in utero, they're in a center who can actually look after. Even the biggest center probably will do in Abu Dhabi will do 2 babies a year. So it's not a lot of them, please, really important. And I think you need a more senior person to sit down and have a chat with them. One of the things we learned, we don't know that much about 22-weekers. So I usually say, it's like, having an apple a day keeps the doctor away. The same thing, keep the neonatology away from that baby. Because we're aggressively thinks we know what the normal parameters. And this baby, we're just going to show you that did really well because we did not know what normality is. And that's really important. Parents' wishes, culture, law is really important. And this is just, can you turn this on? Or? So this is actually the baby that I mentioned earlier. So this is the 2 twins, 22 plus 2 weeks.
شو Hey.
20 months and
Baba. أمونة تعالي.
بابا ما شو هذا اللون؟
عبود